My name is Dr. Paul Rein. I'm president of Virginia Anesthesia and Perioperative Care Services, and we're a group of 70 anesthesia providers that works mainly on the peninsula. Our division that covers Riverside Hospital, I should say used to cover Riverside Hospital, was dismissed on April the 7th at 12:01 a.m. And I have a story that's of interest regarding public health and safety on the peninsula, and also about some truly unbelievable actions by Riverside Health System. On October the 7th, we started renegotiating our contract with Riverside to make it with the Riverside Medical Group instead of the hospital. And on February 18th, Dr. Patrick Parcells gave us a contract that we decided we would have our attorney look at. The contract was reviewed, and we went back on an appointment on March the 18th to sign a contract, and were promptly told at that time that Riverside had changed its mind. The problem was there was 18 days notice, and we have 32 anesthesia providers who work on the peninsula, and were given a notice that we had 18 days left to work there. They wanted us to go to work for a company called Compass Healthcare and Soma Health Partners, and they assured us that they were a national group. Interestingly, we decided to check out who this national group was, and it turned out to be that Soma Health Partners was a subsidiary of Compass Healthcare, both out of San Marcos, Texas, and Soma was started on January the 29th of 2010. We were assured that these two companies covered over 20 facilities that were similar to Riverside and had over 250 anesthesia providers. A few days later, I got to meet the director of operations of Soma Health Partners, who was a man named Michael Candelario, and he described himself to us as a 31-year-old who attended Indiana University in Bloomington and Virginia Commonwealth University. He also told us that he worked for Compass Healthcare for 7 years. He was in the Marines for 4 years, and he was a CPA and had an MBA, which is a lot of stuff to do by the time you're 31 years old. So we decided to check out Mr. Candelario and his address on his business card. His address was in a town called Dripping Springs, Texas, and when you checked out that address, there was a barbecue restaurant at the site of his address. Our attorneys mailed a letter to Mr. Candelario at that address. Actually, they Federal Expressed it, and it was returned a day later that there was no such place as Soma Health Partners at that address in Dripping Springs. There was one other business there called Cowgirls and Lace, which happens to be an interior design store that has also nothing to do with Soma Health Partners. So at that point, we were a little bit concerned about going to work for someone who misrepresented himself, and we checked out his references. His references were several hospitals in New Mexico, a hospital in Roswell, New Mexico, and one hospital system in Brownsville, Texas, and a couple of other hospitals down in Brownsville. It turned out that Mr. Candelario's references were also falsified. Eastern New Mexico Hospital never heard of him, used another agency for their anesthesia services when necessary. And other hospitals in southern Texas also denied being affiliated with him. The only places we found was a hospital called Brownsville Doctors Hospital, which was 24 beds, 4 operating rooms, and an ambulatory surgery center with 4 operating rooms. None of them are similar in size and scope to Riverside. So at that point, we knew that this wasn't anybody that we certainly wanted to go to work for. And the next day, there was a meeting of the surgery department at Riverside Hospital, and the surgeons overwhelmingly passed a resolution asking for the hospital to reverse its decision. And the hospital promptly said they were not reversing their decision, that this was a national company that they had properly vetted. Not quite sure who they vetted or what they vetted, but it certainly wasn't the facilities that we called. So, excuse me. We had an on-site, decided to have some people have an on-site visit in Texas to the corporate headquarters of Compass Healthcare and to Soma. The headquarters of Compass Healthcare showed a beautiful ranch home in San Marcos, Texas. When the person entered the facility, there was nothing there except one old brown laminated desk and no people inside, and this was at 3:30 in the afternoon. The headquarters of Soma Health Partners in Canyon Lake, Texas, was also a ranch house in a residential community that was zoned residential. None of the facilities, again, we checked again with the facilities and nothing came up. We communicated this to the leadership of Riverside Health System, and they continued to insist that they were a national company. We are 32 providers that cover a level 2 trauma center on the peninsula. And we also do cardiac surgery, neurosurgery, and 3,000 women deliver their babies there every year. Anesthesia providers are not easy to come by, and when you do, they take 2 to 3 months to be properly credentialed. Soma used at least 6 staffing agencies to try to find providers to replace us. And as of April the 7th, there were 13 temporary providers that were working at Riverside Hospital, none of them who live on the peninsula. And just as an aside, our division paid over $70,000 in business license taxes to the city of Newport News that will now be lost to the city of Newport News, because this is a company in Texas that also uses people who don't live here. During the first 3 days at the hospital, 4 providers quit or just felt that they weren't adequate to deal with the high complex cases that we deal with. And as of this date, this is April the 12th, the cardiac surgery program has been suspended because there's no cardiac anesthesiologist at Riverside. We are all very, very concerned about the safety of our patients. We're concerned about the people on the peninsula. And we think that Riverside Health System should also have similar concerns. This is not an issue about dollars. This is not an issue about coverage. Our anesthesia providers at Riverside have over 500 years of anesthesia experience. And this is the only place, and we're the only providers that they have ever utilized. We need everybody's help in helping us get this righted. And I just ask every one of you who are watching this to let anyone you know about this and to call Riverside. And we need to fix this for the safety of our community. Thanks.